So we have Angie Patchen with us. She's coming to us from the Wood County Educational Service Center. She's going to share a little bit about what's going on with their prevention services and talk about the Suicide Prevention Coalition in Wood County because she is also one of the co-chairs of that coalition. So welcome, Ashley, or Angie. Why did you Ashley? Let's just cut that out. Let me start that over again.
I'll take as much time as you need.
I don't know why I called you Ashley. Probably because Ashley's usually on these calls with me. Have you met Ashley yet, our associate director?
I don't know that I've met her in person. Was she running out at the NAMI dinner thing?
She was, I don't think she picked up her meals at the NAMI dinner thing. She worked for us for a week and a half, and then we had to go into quarantine. And so she works more remotely than she has in person.
That's exciting.
So we have with us today Angie Patchen from the Wood County Educational Service Center. She's going to share with us some information about their prevention services and information about the Wood County Suicide Prevention Coalition, as she is one of the co-chairs of that coalition. So welcome.
Hello.
Hello. So what's going on over at the ESC?
Well, it's been an exciting school year. This was kind of not the way we expected things to go, but our staff are amazing, and they really just adapted really well to the changes and to the very sudden change. You know, we didn't really have a lot of time, and we didn't have a heads up at the ESC any more than anybody else did. You know, we were listening to the governor's announcements and hearing everything at the same time. So, you know, it was, hey, you know, school's going to go to all virtual format, and our staff just really picked up and adapted and delivered a lot of the programming in virtually. Sometimes they were doing it live, sometimes they were recording things and they were being shared at schools. So the teachers and staff were just wonderful, working with them and helping them figure those things out. And you know, so one of the schools asked us if we could do something to help explain a little bit to parents about Google Classroom, and so we put on a training about that. We also offered some trainings, you know, based on, we like to use data, we're kind of nerdy. We like numbers and data and seeing, you know, what the needs are. And so, you know, statewide and even nationally, they're saying that reports to JFS are down, you know, abuse and neglect reports. We know that it's not because kids are not being abused and neglected, but because the mandated reporters that normally see them on a daily basis are not seeing the kids right now, so in person. So we did a training with JFS. One of their staff did a training with school personnel and counselors, and we had a bunch of people jump on that call to find out how, you know, when should they report, and, you know, and how are things handled, and helping to understand the process and that kind of thing. So yeah, we've just kind of picked up and adjusted and worked on things. One of our staff did a series of videos on each of the other staff members in the prevention program, and those have been posted on Facebook. I see you smiling and nodding, so I think you guys might have seen them. So that's exciting, and we've got a lot of people with a lot of different skills and a lot of different you know, years of service and stuff, and they're just doing really cool stuff. So that's on our Wood County Prevention Education page, Facebook page. So I'd encourage people to watch those, share them, because our staff are in pretty much all the districts in the county, so are getting some kind of service from us. So that was kind of a neat little profile of everybody. So yeah, staying busy.
Staying busy, that's good. So we talked a little bit about prevention services over at the ESC and a lot of what you guys are doing. I know something that I know Mylan in your facility was doing was the podcast. Are you guys still doing the podcast?
I believe they are. I haven't personally been on one in a while. We did one right off the bat, like kind of the first week or two into this, where we talked a little bit about the adjustment to being at home and what was happening and the concerns about mental health and that kind of thing. And now that we're, I don't know, 2 months into it, going on 3 months, I guess. I was just thinking the other day, maybe we should do another update. I think that Mylan's done other ones, interviews, but I haven't been part of all of them. I'm a guest speaker.
So, as far as the Suicide Prevention Coalition, what's going on with the coalition?
But we're staying busy too, because of course we're worried, as everyone is, about mental health and anxiety, depression, those kinds of things. Those things have been going up, and and then of course those are correlated to rates of suicide, and the suicide rate in our country had been going up anyway. And then when you throw something like this into it, it's pandemic doesn't probably begin to describe it. It's not just about illness spreading amongst people, but it's all the fear, and it's really a collective trauma. I mean, it's up there with things like 9/11 and other national tragedies that occur. So folks are worried. They're worried about their personal safety, their wellness, those around them. Folks are worried about not only their own health, but their family members and people that have to go to work and maybe losing jobs. And so there's just all these layers upon layers of stress and anxiety and, like I said, all those kinds of things. So that just adds on to people that maybe didn't feel those things before or never felt like they were an anxious or depressed person might be experiencing those things now for really legitimate reasons. I mean, you can't just talk yourself out of it and like, oh, don't worry about it, is not going to apply in this kind of situation. I hear things from a lot of my friends. A lot of people are having trouble sleeping, which of course then affects your immunity, your immune system, and your overall health. And then I don't know about, I've also heard from several people, and I've been experiencing this myself, even when I do sleep, it's like these vivid dreams, like they're super vivid. So you kind of, you were sleeping, but yet you wake up and you don't particularly feel all that rested. So there's all that. And then you're trying to, people have said like work from home, or is it, you're at home trying to work. And it's definitely a different skill set. It depends on what you've got going on in your house. A lot of people were turned into teachers overnight, and they're like, this was not my thing. This was not my job. I don't know how to do this. I'm not trained for this. And yet I'm supposed to, maybe try to work and educate my kids. And there's just a lot of things going on. So the coalition has done a couple of things. We purchased some earbuds with the HOPE logo on them and distributed those to first responders and some of the essential workers like the hospital, the fire departments, police departments. My husband went with me to do some of the deliveries, so it was easier. It was his day off, and so I rounded him up and made him drive me around so that I could just hop out and do like contactless delivery. I'd call every place, tell them we were coming, leave the stuff outside the door. And we were in parts of the county that he goes, I don't think this is Wood County anymore. I said, no, it really is. I promise. I can show you a map. But we were out in the rural areas, And then we also delivered those to nursing homes, and like I said, the hospital as well. I was going to say something else. I just went blank on what it was. Oh, we also had some stickers printed with the HOPE logo, the Wood County Crisis Line phone number, and then a QR code that goes to the suicide prevention.
The resource guide?
Resource guide, thank you. Suicide prevention resource guide. And so we're going to give those out to the schools, so they can include those with the lunches that are going home, because a lot of them are doing lunches even over the summer, or some districts are doing lunches to at least some of the kids over the summer. And then the food banks also. So folks that, again, that might be struggling and in need of extra resources know, where they can go if they're having thoughts of suicide or concern.
That's a good idea.
Thank you.
So I know the coalition also has some trainings that they do. I know you and Amy, the other co-chair, lead QPR Training. I was wondering if you could talk a little bit about that.
Sure. QPR Training stands for Question, Persuade, Refer. And it's a very basic training, just getting right at the skills of recognizing warning signs and how to ask somebody if you're concerned about them. And we talk about indirect ways to ask and more direct ways to ask. And So we've offered that virtually just once, but we would hope to do that again more as time goes on. They're allowing us to do that. It's funny with programs, a lot of the programs and the best practices for a lot of programs, particularly when we're talking about mental health and suicide, are to do it in person. But that's just not possible right now, to have, groups of people getting together and all that kind of stuff. So this is a much safer way to deliver the same kind of programs, and we want people to be able to ask and to know that it's okay to ask. And our coalition actually put out a little animated text video a while back within the last year. I don't know exactly when because time doesn't mean anything anymore, but so within the last calendar year, we had this little animated text video made. And it's, a conversation between two people, and it's somebody giving the kind of indirect and more direct clues about being depressed, at least, possibly suicidal, and the other person picking up on those and deciding how to respond to them and responding in a helpful way. And we kind of ended it with, just asking the question, are you thinking about suicide? And the point of that was, it is okay to ask. For a long time, people thought that if you didn't talk about it, that would just, help them not do it. But that really isn't helpful. Not talking about it just kind of puts it in the closet. It makes everybody think like, well, you won't bring it up. How do I bring it up to you? And how are you going to respond if I say, that I'm having these thoughts? So, we want people to be comfortable asking someone else, are you thinking about suicide? Are you thinking about killing yourself? Are you thinking about dying? Whatever way, they're able to ask it, so that, but because they'll bring, opening it up and asking those words, saying those words to someone gives them kind of permission sometimes to say, oh, yeah, you're saying it, so yeah, I can answer you honestly. So that's kind of what QPR is. It's a really short training. It's only an hour, as opposed to, some of the other curricula that some of us are trained in. It's kind of the quick and dirty version of it's just about suicide. We don't really get a whole, we talk a little bit about depression, but not as much as some of our other programs. But it's certainly better than nothing, and it's certainly, I hope, an empowering process for folks to learn that, like I said, that it's okay to ask those words.
Great. So, Bree, do you have any questions for Angie?
I don't actually know a whole lot about the QPR training, but are you doing it in like an online format? Like, is that still available? Is that how you usually do it? Just a little bit about that.
We've offered it. Yeah, Amy and I are trained in it. We've been trained for about 2 years, I think. And we've offered it 3 or 4 times in person. So this was new for us, and it is definitely different, because of course when somebody signs up for the class, you don't know why they're signing up, if they're worried about themselves or someone they know or care about. And so it's not ideal, again, to do it, virtually. I mean, it's not what we would prefer, but like I said, I definitely think it's better than nothing. So we just ask people to make sure that they have their cameras on, so that we can actually see folks. I want to be able to look at them and see and notice if they're struggling or whatever. We could ask questions using the chat box and have people answer that way and that kind of thing. We only had, I think, 2 people that joined us, so we were able to, we went through the PowerPoint, and then we were able to take that down and just kind of chat, as best we could. Also, if there were any additional questions or that kind of thing. So.
Right.
Yeah.
So I don't have any more questions. If you don't have any more questions, Bree. Angie, do you have anything else to add?
I don't have any answers, no.
No? Well, thanks for joining us. It was really appreciative to learn a little bit more about what the coalition's doing and some of the prevention services in the community.
Thank you.
Thank you.